Okay, so this is going to be a demonstration for PAILs and rails of the knee, specifically internal rotation, external rotation of the tibia, okay? So we don't really think of the knee as being rotational. We just sort of think of it as being very linear, flexion, extension, but there is a degree of rotation that must be maintained in the knee for really, really good movement, okay? So I'm going to use my right hand as a resistance hand, my left hand as a stability hand for when we do external rotation of the tibia. We're going to do external rotation of the tibia using the foot and the ankle as an assisted device. So its ankle and the foot is also going to rotate, but the hip and the femur is going to stay in one position, okay? So I'm going to take a hold of the foot, give the ankle a little bit of stability there. I'm going to bring my hand around behind the knee and then around the elbow to give it some stability. And then I'm going to rotate that foot ankle outwards. You're going to notice that the tibia is also going to rotate with it. So you're going to hold this position in a passive stretch for about 2 minutes. 2 minutes is a really important number because according to research, it is when anatomical structures actually change. So tissue, we see tissue change at the tissue level, and we get increase in flexibility and mobility. So 2 minutes. After 2 minutes of holding into this passive stretch, you're going to start internally rotating that foot against the resistance of your hand. You're going to increase your whole body tension, so your irradiation of your whole body up to incrementally. So you're going to ramp it up from maybe 10, 30, 50, 60, 80. At 80, if you're a newbie, you want to stay right there for another 5 seconds. But if you want a little extra challenge, you're going to increase tension all the way up until 100%, okay? That's like going to be your max. So everything is going to be really, really, really tight. Your core is going to be tight. Your hands are going to be clenching. Your foot's going to be digging into the ground, etc., etc. And then at that 100%, you're going to also wait for 5 seconds, and then you're going to start rotating in the opposite direction. So now you're going to be rotating away from the hand into more external rotation. So you're going to continue holding full body irradiation. You're going to pull away from that hand for a whole 15 seconds, and then you're going to take the hand, you're going to place some pressure on the foot, ankle, so that you can now hold a new passive stretch in a new position, okay? A new end range position. You're going to relax everything. You're going to hold that new position for you're going to hold it for 1 minute, and then you're going to repeat the entire process. You're going to push into internal rotation 15 seconds, increasing whole body irradiation all the way up to 80 to 100%. Then you're going to pull away 15 seconds, and then put that hand right onto that foot so that you are holding in a new stretch position. You're going to hold that for 30 seconds. That whole thing is going to be your stretch. That's usually what I recommend, but do follow your practitioner's advice. Okay, so then you're going to go into internal rotation. So everything is the exact opposite. This is going to be my resistance hand now. I'm going to come into internal rotation. My stability arm is going to become, or hand is going to come across here. We're going to hold this new stretch position 2 minutes. Then we're going to push into external rotation with the foot. We're going to increase whole body tension to 80%, 100%, hold an extra 5 seconds, and then we're going to rotate away from the hand, pull, maintaining full body irradiation. And then you're going to take this hand after 15 seconds and you're going to place it right here so that you can now hold this foot, hold this position in its newest end range. You're going to hold it for a minute, and then you're going to repeat the process. So then you're going to push the foot into external rotation, increasing full body irradiation to 80 to 100%. Then you're going to pull away for 15 seconds, and reposition that hand so that you get a deeper stretch again. You can do that for about, and then hold that for about 30 seconds, okay? And that's it for this, for internal rotation of the knee also. So that is PAILs and rails for the knee joint in internal and external rotation of the tibia. All right, enjoy.